Everyone has something on their body they'd like to change, but there's also a lot of people who'd prefer not to go under the knife.
Well, Dr. Lucia Mireles-Chavez from Las Vegas Medical Institute has a few alternatives you might want to hear more about. Good morning, Lucia. How are you?
Good morning, and thank you so much for having me.
Yeah,
Well, we appreciate you being on. Obviously, we've got lots of things to talk about. So you brought a couple of different implements that you guys use. We're talking about less invasive things for people to make alterations and help them out. So the first one's Morpheus8.
Yes.
That's this one?
This one.
What is it? What does it do and how does it work?
So this is FDA cleared microneedling with RF energy, so radio frequency.
Okay.
So with that, you get dermal remodeling, fat destruction, and also skin contraction, which is first on the market to do this.
Yeah.
All of them together.
So what areas of the body can it treat, and what kind of results are patients going to see with this?
So mainly the skin contraction, the crepey skin, the stretch marks. You could use it anywhere in the body.
Yeah, GLP-1 treatments are super hot right now. I think I saw a stat the other day that 1 in 8 people in the US are on a GLP-1 diet or regimen or you know, medication. As a result, some people are being left with saggy, loose skin.
Correct.
And you're saying that the quantum RF, the long wand right here, is something that might be useful for people. So how does this one work?
So this is the same concept, but this is now underneath the skin, getting those deep tissue levels and much higher degree of skin contraction.
Yeah.
So
Yeah, and so for patients with this now, what are results like in seeing this after this is done?
almost immediately you do see some degree of skin contraction, and then the rest is over the next few weeks. With the continuation of Morpheus and Quantum together, you can see continual skin contraction and dermal remodeling.
That was going to be something but else we were going to ask. You can combine both of these procedures, and they work in tandem with each other. What are the kind of results and things are people seeing from both of those?
So this will be deeper skin tissue for skin laxity, and this will be more for what you see with the naked eye. So crepiness, texture, stretch marks, anything like that. That would be more for the surface. This will get that.
Yeah.
So in combination, they can work really well together.
I think when people are determining if, you know, they're going to go under the knife for the results that they want to see or not, a big key is downtime. So when this is happening on these devices, is there any downtime involved in that at all? Because people are scared of pain. That's the whole reason they don't want to do any real surgeries in that sense.
Correct. So besides not having to use general anesthesia and all of that entails, the downtime is from a couple of days to maybe, so this is like 48 hours. You feel like you've had a sunburn. Really light.
Redness of skin.
Redness. Yeah. And you're back to work that same day if you need to be. This one is perhaps a little bit more. They're both done with local or tumescent anesthesia. So the patient is awake. They can go back to work the next day. There's minimal downtime with this one, maybe about a day.
Yeah.
And how long are you saying until patients see results? Is it from every session they can start seeing the improvements or differing in their skin?
They can. Typically they're done in a series of 3. This one is about 1 to 2. This is about 3. But you can see results right away, and then the continual dermal remodeling with the neocollagenesis is up to 6 months.
And how long do those sessions last? How long do you need to go for each session for both?
About 2 hours.
2 hours.
Right,
okay.
It's 2 hours for each one of these.
What is that feedback that you're getting from patients? I mean, even from a long-term standpoint after doing these procedures?
Yeah, they're extremely happy. They didn't have to invest in a huge surgery. Not a lot of downtime. That was not very painful. I'm not going to say no pain, but very, very little pain. So they were surprised at that. And the degree of contraction is what they're most happy about.
Obviously, you have these 2 new cutting-edge services. Are there any other traditional services that you guys have, renowned for using as well that you use for your patients?
Yes. So we have a concierge longevity regenerative center. So we do everything from red light, hyperbaric, peptides, hormone replacement, medical weight loss. So they're all in combination with the regenerative aesthetic treatments.
Oh, that's wonderful. Thank you so much for joining us this morning.
All right. Thank you so much.
To learn more about the Las Vegas Medical Institute and both of these treatment options, just visit LasVegasMedicalInstitute.com.